New videos every day.
All right, I'm John Breeding. It's June 3rd, and it's a very hot day in Austin, Texas, like 95 degrees or so hot. And a guy that I know named Ron Thompson, who's a lawyer up in Northeast, I think New York City, an ally in challenging psychiatric oppression, sent out an email a little while back alerting me to this, a recent National Public Radio bit interviewing a U.S. Army general, don't know the man's name, whose son was also in the Army and was a medical doctor. Well, the medical doctor, Army son, committed suicide due to depression. And this was the general's response to this. And what the general said was that his response was to pledge to prevent suicides by getting more soldiers to see psychiatrists. So it's pretty common to see, people who lose a loved one, a child, or whoever, respond in a way that says, I'm going to try to at least have meaning and purpose in this by preventing this for other people, or so helping other people avoid the horrible thing that I went through. That's admirable and commendable. What's unfortunate is when you have false data that leads you to the wrong conclusions, or just such a strong belief system that you're unwilling to see the conclusions. It's like a Orwellian kind of universe in which you're unable to speak or see reality clearly because such of a strong belief system. In this case, it's so strong that people who are oppressed by psychiatry don't even realize they're oppressed, or duped, as the case may be. For those of you who tend to listen to my videos and look at the reality of psychiatric oppression and the reality of psychiatric drugs, you know that antidepressants cause suicidal dynamics in a percentage of people who take the drugs. They exacerbate or actually cause it by creating a psychic state that's so unbearable and so out of touch with reality that people then act out self-destructively or other-destructively in terms of violence and aggression. I've just been reading one of Peter Bregan's new books, Medication Madness, that lays out many, many, many cases of suicidal or homicidal actions apparently caused by psychiatric drugs, by their spellbinding effect, by the effect of medical intoxication. In this case, specifically the antidepressants, especially the SSRI antidepressants, Prozac, Paxil, Zoloft, Effexor, Celexa, Remeron, etc., are all known to cause or exacerbate suicidal ideation and action, such that they now have warnings to that effect. So it's unfortunate maybe that this Army general doesn't know that and or is unable to look at that. And that his response, his healthy response of getting help for soldiers, is ruined by the fact that psychiatric helps tends to mean psychiatric drugs, which just make the problems worse, or at best cover them up. It's really sad. A good friend of mine, Glenn McIntosh, daughter, age 12, committed suicide at the Cedar Park Middle School just north of Austin by hanging herself in the bathroom at the middle school. He got into suicide prevention work after that, out of his own need to do something positive in response to that. When his story was published in the Austin American Statesman, I wrote a letter to the editor suggesting that, maybe a look at the drugs involved would be a good idea. Glenn didn't respond to that at the time, but a year or two later we connected, and it helped him to gradually shed that and other people's help, particularly Ann Tracy and drugawareness.org, helped him to realize that the SSRI antidepressants caused the kind of problems that his daughter was experiencing and likely were a causative factor in his own daughter's suicide, and he then since became an activist and an ally helping us. You'll see him in some videos. You'll see him in the prescription suicide video. You'll see him in the other video by the Australians. I can't think of it at the moment, but about the marketing of psychiatric drugs. Hopefully this general maybe will come around the way that Glenn did. My friend Dr. Fred Bauman has been doing big work recently looking at military deaths apparently caused by psychopharmacology. Here's a little email that he wrote. He's describing a Chicago Tribune article from February 7th, 2008 called Military Eyeing Mysterious Deaths, where the Surgeon General of the Army, Eric Schumacher, said there's been a sequence of deaths in the new warrior transition units, accidental deaths, we believe often as a consequence of the use of multiple prescription and non-prescription medicines. Fred Bauman asked whether these studies of these deaths have been published, and the answer was no. But his own work has indicated that these deaths are virtually certainly cardiac deaths, virtually certainly due to a specific drug cocktail that involves Seroquel, Paxil, and Klonopin. 20-year-old people just don't die of sudden cardiac heart deaths, and certainly not in a patterned way. And that's what you're seeing with these young soldiers. Fred Bauman is revealing this data. In the Charleston Gazette article of March 1st, 2009 by Julie Robinson, that's laid out. Seroquel, Klonopin, Paxil. Sudden deaths. Another series of articles by Melody Peterson in Men's Health Online, you'll see this issue of psychiatric drugs in the U.S. military. And there's the stuff that Fred's revealing with these sudden cardiac deaths, but there's also stuff related to the suicide and the violence. PTSD, traumatic brain injury, these kind of things are being treated in the military big time by psych drugs. And it's often making things worse. By the way, the military is using psych drugs in all kinds of ways. After having been seriously disillusioned of this during Vietnam, that getting to be considered a bad policy, nowadays with Iraq and everything, it's used all the time to mask pain so that soldiers can keep going, to mask anxiety so that soldiers can keep going, to pump them up with amphetamine-type drugs so they get fired up for battle. All these things. Anxiety, depression, pain, to help with sleep. And then they get strung out on benzodiazepines and Ambien. You know, you've got a drugged soldiery to a large extent. And then afterwards, when they're traumatized, they're labeled PTSD and they're given more drugs and sudden cardiac deaths, suicide, homicide. This Army general could really help by becoming aware of that and speaking out to that, and possibly seeing his own son as a casualty of that, rather than a casualty of some biologically or genetically based illness called depression, which requires drugs to treat. That's a belief system based on false data and lack of understanding that leads to a treatment that's called profit for big pharma and havoc on the brains and bodies of those who are considered patients. That's it. That's it. Suicide prevention by sending more people to psychiatry and getting more treatment is not a solution. It's a marketing thing, and it's a severe, great misunderstanding that leads to damage and harm done. We need to face the reality of war, the reality of distress, and the possibilities of dealing with people in more peaceful ways and dealing with ourselves in more peaceful ways to bring forward recovery, healing, reemergence through whatever challenges we face in life. That's it for today. Thank you.
If you liked this video, we have hundreds of more alternative videos ranging from sexual health to psychology to mind control. So if you liked it, go ahead and click on me to enter the Psychiatric channel.